welcome. Getting into the last day of October here, so doing well. Getting busy with everything that you guys need to do for your midterms and finals. So, quick updates as I find the different plugs to plug in. We're already on 10 of 14, so that means we only have about 4 chapters left, which is, good or bad news if you have a lot to catch up, or if you have other things to do. So chapter 10 is getting into our policy. A lot of social workers are big advocates on what they do, how they do it, and making sure that these things are working for you guys. So, starting out, I'm going to go through kind of your cliff notes in the Dubois and Miley book, and here is the beginning. So social work policy, we defined as principles and courses of action that shape quality of life. The purpose of our public policies, a lot of social workers do advocacy work and even become a lobbyist in Washington, D.C. The purpose is to redress inequalities in social institutions and to provide assistance to persons in need. So we've had this for a long time, not just in America, but for a long time before our country started having social workers and even case managers. A lot of the hospitals, as we mentioned several classes ago, they were run by the church. That's why they're called now like St. Elizabeth or Christ Hospital or one of those. When advocating the process, first, you're going to try to formulate policy. So that's when you see people putting ideas into the 3 branches of government. So starting with your local politician, it might be your congressman who would advocate for you. Each state only has 2 senators. And then that is the way that we represent and push policy through. So the senators vote on it, Congress will vote on it. There's about, I don't know the exact number, but a good 500 congressmen and women. So usually as social workers, we help with this information gathering piece. So if we're getting data and inflation, and that's what our next discussion is about. Inflation, actually shrinkflation, because that's the way they're trying to trick us. The value of our dollar has gone down significantly. You often see that in inflationary prices, but the way they will hide that is you'll see the candy bars get smaller, the bag of chips get smaller. They're still the same price, so you really don't notice it, but if you are observing, you can see that that bag of chips is now 5 ounces instead of 6 ounces. So social policy as a product, programs and services, they help with enacting legislation, and the 3rd branch of government, executive orders can be done. There's also congressional actions and judiciary interpretations. That would be the Supreme Court and federal courts. And then administrations that enforce the policies make those administrative decisions. So our focus on policy as social workers, we often look at the specifications, the feasibility, and then the merits, like who is it going to serve? How is it going to help people? How is it going to serve people? Then the applications from formulation to implementation of policy. And a lot of times we talk about putting policy to action. It's similar in social work where we put theory into action. There's also the legislative analysis and lobbying, so you see how well that policy is still serving. You see if that policy is still needed. A good example might be the coronavirus policies. We might not have those policies in a few years from now because there may have been a vaccine or there may be a way to have ended the pandemic, so it's not affecting everybody in the lives and jobs. So some social policy and political ideologies, you have the range from liberal to conservative to radical, and then there's also social work and political ideologies. So those are some of the things you'll look for. The social work and social policy that informs policy and policy informs the practice. We let these two play off each other. So in social work, the practice we do, the people that we see, if we see an influx of homeless people or a lack of affordable housing, we try to push policy that would help this affordable housing. Also, the integration of policy and practice. We have direct practice where we are serving, say, the homeless under the bridge. We have agency and organizational policies that may help provide funds to the folks that are giving coronavirus relief right now. And then in the fields of practice, addiction policy is a big one recently with the opioid epidemic. So as I'm looking at some of these, Ohio passed about $400 million for opioids, and then I'm sure Kentucky is not far behind us because of this epidemic. There's been a lot of child welfare policy that has come from that, and things that you see, homelessness and addiction recovery, incarceration rates. So when you're looking at social work and social policy, you have four things here: the social service system, then you have the social welfare institution, societal context, and then the global context and international policies. Make sure this fits on the screen for you guys. So here's how practice informs policy. First, you have a client and the social worker. You may have someone without housing come to the social worker at the agency and organization. And there's the field of practice, either mental health, income maintenance, housing, or child welfare, and then corrections. Then there's the social service system, all fields of practice, public and private organizations, professional associations, accrediting agencies like CSWE and NASW, the funders, and finally the citizen interest group. And then social welfare institution like health and education welfare. Society has like the culture, ideologies, social structures, and social institutions. And even reaching out more than just social workers in America, we have global human rights and global world economy and the interdependence. And then the policy influences practice going back the other way. As we see the things and they need changing, like hopefully we don't need coronavirus funds sometime next year or the year after, that changes and maybe we'll go into more pushing funds into the job market. Here's an example of ways policy influences practice. So it determines the interaction between clients and practitioners. It reflects the intent of the agency. It establishes service priorities and then identifies target population groups. So most recently, I mentioned not just coronavirus, but addiction recovery, also the housing. Some of the recent policies in the pandemic is that you cannot evict folks. There's a federal halt on evictions so that housing does not become a crisis until we get through this pandemic. Other ways, examples of policy influencing practice, it stipulates funding parameters, it specifies jurisdictional boundaries, and then directs practice activities. So some of the jurisdictional activities are, for example, Ohio and Kentucky has their own set of funds for addiction recovery and coronavirus. And it'll give the parameters of the funding, like how we can spend the Medicaid dollars. Now, since the Affordable Care Act, there's been a large outreach of different social workers being able to see clients that we were never able to see before. So there's also street level services. So the street level bureaucracies, that's like the governmental service sector. And some examples are like even our food pantries and our soup kitchens. So starting with those very basic of needs. Also street level bureaucrats. They help allocate welfare and protect public safety. And they are subject to some bureaucratic constraints. Like at our food pantry, for a while, we were unable to serve people that didn't have a social security number, like the undocumented. And we kind of worked around that. We had some of the St. Leo food pantry donations come from the church, and we didn't use that federal subsidy, so we had to come up with a social. And there's ways to get around that and serve those that are in need, no matter what their situation is. Some street level clients, labeling and the social construction of clients. So finding ways to get them out of their stigma that they'll be stuck in getting food pantry and housing subsidies forever. We'll try to do some of the empowerment pieces and find ways to empower our clients to move on up. Here's a quick history of the public welfare since social work has been enacted in the early 1900s. So the progressive era was the 1910s until the 1920s, like the Roaring 20s. After that, we had the New Deal and the Great Depression, so that was the 1930s. Interestingly, the US went off the gold standard in 1933. So we changed our dollar, which was a US $20 bill was a 1 ounce gold coin until 1933. And we changed that to paper dollars, and we still used silver dollars until 1971. But to be able to fund a lot of these programs, we had to go off of that gold standard. To be able to print money and create even student loans and funding for World War II after some of that challenging times. Then we had the Great Society programs, that was in the 1960s. New federalism in the 1970s, that's when we went off silver dollars. August 15th of 1971, we took away the silver dollar, and now it's just a paper petrodollar that we use. So we can print more of the money, and that's also why we've seen a large amount of inflation. So the video you'll watch for next week is about shrinkflation and how packages of food and things have gotten smaller, even if the price stays the same, because they don't want to show the price getting more expensive if the package size did stay the same. We did a bit of welfare reform in the 1990s, and then we had healthcare reform in the 2000s. So that's kind of when social workers started having access to almost every client in the US with the Affordable Care Act. This table is helpful because it shows our social welfare history, and this is on Schoology for you, but it goes from 1921, where they had Act for the Promotion of Welfare and Hygiene, of Maternity and Infancy, so that was during the Roaring 20s. We had the Federal Emergency Relief Act in 1933, so that was when they saw the Great Depression was real bad. Again, they took us off the gold standard, so everyone turned in their gold coins and were given back paper dollars to pay for things. Then in 41, the executive order barred racial discrimination in defense industries, establishing the Federal Fair Employment Practices Committee. In 44, we had the Servicemen Readjustment, so that's the GI Bill that helps pay for college if you served in the military. In 50, we had amendments to Social Security for aid to the permanently and totally disabled. In the 60s, there was a lot. So 62, we had amendments to the Social Security Act for social service provisions. In 64, we had the Civil Rights Act. In late 64, we had Economic Opportunity Act and the Food Stamp Act. So you see a lot around the 1964 kind of a global awakening from television, similar to what we've seen in the 2000s with a global awakening of internet revolution. 1971, the Talmadge amendments to the Social Security Act for the food work incentive, and then excuse me for 1 second. Just have to say yes to the cardiologist. I've had a little bit of stress in the mid-40s, and you notice it on the heart. So 71, where we went off of the silver standard I mentioned, August 15th of 1971, there was Talmadge amendments to the Social Security Act for a work incentive program. So here it was the beginning of where the government can more easily print paper money, because we don't have gold coins or silver coins, and printed paper money can be duplicated. So we saw a lot of inflation in the 70s. 72, there was a Supplemental Security Income Program. That was SSI. It replaced state programs for aid to the aged, blind, and disabled. In 75, the Title 20 amendments to Social Security Act for social services. And then in 81, the Omnibus Reconciliation Act, Family Support Act in 88. And then the big legislation was Americans with Disabilities Act in 1990. You'll hear a lot of that even in school if you have ADHD or dyslexia and you're still able to access these resources with aid. In 93, there was the Family and Medical Leave Act. So FMLA, it'll protect you from your job if you have to leave for medical or family stuff, and you are protected to come back to your job. In 96, we had Personal Responsibility and Work Opportunity Reconciliation Act. And then in 96, at the end of the year, there's the Health Insurance Portability and Accountability Act. So HIPAA, and as social workers, we have to pay attention to that because we cannot break HIPAA where someone would have access to our client's records. So that's where our confidentiality is enforced and things that we, as social workers, must follow that. In 03, we had Medicare Prescription Act, and so the Medicare Prescription Drug Improvement and Modernization Act. And the big one I've been talking about that gave everyone access to a social worker was 2010, the Healthcare and Education Reconciliation Act. And that includes the Patient Protection and Affordable Care Act. So all of that was passed by 2011. And again, we do see inflation with some of these. The printing of money in 2010 and 2011 was a lot. It went from about $1 trillion up to, I think it was $2 trillion. And then from 2012 to 2019, we didn't have much. I think we got to $3 trillion by the beginning of this year. Coronavirus, however, put us into a different league. Now we've gone from 3 trillion in circulation to about 6 trillion to provide relief to all those families, to give stability in the markets so people can keep their jobs. And you know, it is showing up again in the, if not inflation, definitely shrinkflation, and serving sizes are getting smaller. Some of the public welfare programs, we have the old age survivors, disability health insurance. As social workers, some of our funding comes from this, the Temporary Assistant for Needy Families, so TANF. Also Supplemental Social Security Income, SSI, and then general assistance. Some of the public welfare programs, along with Medicaid, so Title 19 and Medicare was Title 28. We also have supplemental nutrition assistance programs, so that was SNAP. and then the Social Security Service Block Grant, so Title 20. So different areas of funding, lots of policy that social workers need to pay attention to, and find ways to advocate to folks that are in need. So finishing with this slide in chapter 10, so table 10.2, this is the public assistance and social insurance compared. So public assistance, the policy intent was income support for people meeting eligibility guidelines. Social insurance is more of supplementary coverage for contributors. Some examples on public assistance are like TANF, SSI, and SNAP. Whereas in social insurance, there's OASBI. Some of the public assistance auspices and administration, there's both federal and state, whereas social insurance is only federal. The eligibility in public assistance, it's more needs-based, so the participant must meet the test of income and assets, whereas social insurance, great idea, but is only based off contribution, so your eligibility is based only on the credits achieved. Any benefits, so in public assistance, it's a variable amount, and it differs among states. The principle of lesser eligibility applies. Whereas with the social insurance, you have more fixed benefits based on coverage. And the related medical, we have Medicaid there in public assistance, whereas with social insurance, there's Medicare. The last two, relatives' responsibilities, are applied to legally defined dependents. With social insurance, there's none, no relative responsibility. And the last one, public's perception, stigmatizing the poor, whereas social insurance, viewing as a right. So remember to get your field observation homework assignment done, and watch the video on inflation and shrinkflation, and I'll see you guys next week. So have a good one and enjoy Halloween.